We are working on a variety of measures to try to cope with this very challenging situation. We've ramped down services across the whole of HHS and are considering further ramp down measures to try to free up appropriate resourcing to allow us to cope with what's happening. We are implementing return to work protocols to bring staff back as soon as is possible, having regard to all the circumstances. We're doing our utmost to reintegrate workers who are returning from self-isolation, the normal course of things, to make sure that we're maximizing the staffing resources that are available to us. And of course, as always, we're working with our partners across the sub-region and our partners across the region, Ontario West, to implement load balancing measures to make sure that where there is capacity elsewhere in other hospitals, that everybody is carrying a reasonably equal share of the load.
The pressures, we've talked about this at so many town halls in terms of the pressures we're feeling and how that translates into our occupancy. I think it feels like 200%, not 102%, I'm sure, for those on the front lines. The other comment I'd make around our decision making and our ramp down, we did use the ethical framework. We did adapt that framework for ambulatory care. And we did follow the principles of the directive around equity, proportionality, minimizing harm to the patients, and reciprocity when we're making these decisions.
The situation right now is quite different because the wards are vastly impacted with the absences of staff and physicians because of the virus impact on themselves. So it's a very different scenario than what we had in the prior wave. Omicron is a different variant, creating a different picture for us. The principles that we're also working with, and again, feedback from the last wave, was really trying to avoid moving people around more than once. We are trying wherever we can to minimize this disruption, but of course, it's a very different circumstance and the needs of the units are quite different. So bear with us, and many of you have been doing that. We thank you for that.
We now have both resilience and crisis supports available to leaders and teams and staff 7 days a week. We have folk who are on site to provide what we're calling psychological first aid, folk who are psychological first responders, as well as virtual supports available for leaders, individuals, and clinical teams. There's scheduled support 7 days a week for frontline staff who want to just have a place to touch in, talk, debrief, gather some resources to shore up their resilience. And those are available through our daily staff support huddles on Zoom. And then twice a week, we also have specific leader support huddles because we recognize that there are different but intense demands on both staff and leaders during this time.
I think the most exact at this point is probably ICU admissions, or people admitted in the ICU and COVID positive, because here I think it's fair to say that the vast majority of those who require ICU care clearly suffer from their COVID infection at this very point of time. Based on the provincial data, roughly 85% of those patients currently admitted to the ICU are COVID positive.
We absolutely need you to take care of yourselves in the best possible way so that you can continue to take care of our patients. So thanks for all of your contributions. I can't tell you how grateful we all are for what you're doing. You're making such a big difference for our community. So thank you. Have a great rest of the day.